Question 1. Operational review demonstrates that a patient experiencing an acute psychotic episode is refusing prescribed antipsychotic medication, stating they do not believe they are ill and that the medication is a form of control. The APN has assessed the patient and believes their capacity to make an informed decision about this medication is significantly impaired due to the active psychosis. What is the most appropriate course of action for the APN? Option A. Engage in therapeutic communication to build rapport. Assess the patient's capacity for informed consent, explore their concerns, and involve them in decision-making to the greatest extent possible while documenting all assessments and interventions. Option B. Administer the medication immediately to prevent further deterioration, as the patient's refusal is likely a symptom of their illness. Option C. Document the refusal and wait for the patient's condition to improve spontaneously before attempting to re-engage them in treatment discussions. Option D. Respect the patient's refusal and discharge them from care, as they have the right to refuse treatment regardless of their mental state. The correct answer is A. Engage in therapeutic communication to build rapport, assess the patient's capacity for informed consent, explore their concerns, and involve them in decision-making to the greatest extent possible, while documenting all assessments and interventions. Explanation. This scenario presents a common implementation challenge in psychopharmacology, balancing patient autonomy and safety with the need for effective treatment, particularly when a patient's insight into their condition may be impaired. The APN must navigate the complexities of informed consent when a patient is experiencing active psychosis, which can significantly affect their capacity to understand the risks, benefits, and alternatives of medication. The professional challenge lies in upholding the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, while respecting the patient's right to self-determination, even when that determination may seem detrimental to their well-being. The correct approach involves a multifaceted strategy that prioritizes patient safety and therapeutic alliance while working towards regaining capacity for informed consent. This includes a thorough assessment of the patient's current mental state and capacity, engaging in therapeutic communication to build trust and rapport, and involving the patient in decision-making to the greatest extent possible, even if that means making shared decisions or decisions based on previously expressed wishes or the wishes of a surrogate decision-maker, if applicable and legally permissible. The APN must also document all assessments, interventions, and discussions meticulously, demonstrating a commitment to patient-centered care and adherence to professional standards. This approach aligns with the ethical guidelines for advanced practice nursing, which emphasize the importance of patient advocacy, shared decision-making, and the provision of evidence-based care, even in complex situations. An incorrect approach would be to unilaterally impose medication without adequate assessment of capacity or attempting to engage the patient in the decision-making process. This violates the principle of autonomy and can erode the therapeutic relationship, potentially leading to non-adherence and further distress. Another incorrect approach would be to delay necessary treatment indefinitely due to the patient's current lack of capacity, which could be detrimental to the patient's recovery and well-being, thus failing the principle of beneficence. Forcing medication without exploring less restrictive alternatives or without a clear legal and ethical justification, e.g., imminent danger to self or others, and following established protocols for involuntary treatment if applicable and authorized by law, would also be a significant ethical and regulatory failure. The professional decision-making process for similar situations should begin with a comprehensive assessment of the patient's mental status, including their capacity to understand their illness and treatment options. This should be followed by open and empathetic communication, aiming to establish a therapeutic alliance and explore the patient's perspective. If capacity is impaired, the APN should explore less restrictive interventions, involve family or designated support persons, with patient consent where possible, and consult with colleagues or supervisors. The decision to administer medication, especially in the context of impaired capacity, must be carefully considered, documented, and aligned with legal and ethical frameworks, always prioritizing the patient's safety and best interests. Question 2. Research into the clinical presentation of a 68-year-old male with a history of hypertension, type 2 diabetes, and chronic obstructive pulmonary disease, who presents to the clinic reporting new onset of shortness of breath, chest tightness, and fatigue. He has a known history of non-adherence to his prescribed medications for diabetes and hypertension. Which of the following approaches to clinical assessment and diagnosis is most appropriate for this APEN? Option A. Conduct a brief physical assessment and rely heavily on the patient's past medical history and previous diagnoses, concluding that the symptoms are a predictable exacerbation of his known chronic diseases and require only a minor adjustment to his existing medication regimen. Option B. Focus the assessment primarily on the patient's reported non-adherence to medications, assuming that his current symptoms are likely a direct consequence of uncontrolled chronic conditions and require immediate medication reconciliation and education without extensive further diagnostic investigation. Option C. Prioritize the evaluation of the shortness of breath as a potential sign of a new, unrelated respiratory infection, and proceed with empiric antibiotic treatment based on this assumption, deferring a comprehensive assessment of his cardiac and diabetic status. Option D. Initiate a comprehensive diagnostic workup including a thorough physical examination, detailed patient history focusing on symptom onset and exacerbating factors, review of current medications and adherence patterns, and consider appropriate diagnostic tests such as an electrocardiogram, chest X-ray, and laboratory studies to rule out acute cardiac or pulmonary events, while also assessing for potential diabetic complications. The correct answer is D. Initiate a comprehensive diagnostic workup including a thorough physical examination, detailed patient history focusing on symptom onset and exacerbating factors, review of current medications and adherence patterns, and consider appropriate diagnostic tests such as an electrocardiogram, chest X-ray, and laboratory studies to rule out acute cardiac or pulmonary events, while also assessing for potential diabetic complications. Explanation: this scenario presents a professionally challenging situation for an advanced practice registered nurse, APEN, due to the inherent complexity of accurately assessing and diagnosing a patient with multiple comorbidities and a history of non-adherence. The challenge lies in differentiating between symptoms that are directly related to the acute presentation, those that are exacerbations of chronic conditions, and those that may be influenced by the patient's past behaviors. Careful judgment is required to avoid diagnostic overshadowing, where a prominent symptom or condition leads to the neglect of other potential diagnoses. The correct approach represents best professional practice because it prioritizes a comprehensive, systematic, and evidence-based assessment. This involves not only a thorough physical examination and detailed history, but also the judicious use of diagnostic tools and consideration of the patient's psychosocial factors. Adhering to established clinical guidelines and scope of practice for APEN, as mandated by regulatory bodies such as the specified U.S. State Board of Nursing or relevant federal guidelines if applicable to the exam's jurisdiction, ensures that the diagnosis is accurate, safe, and appropriate for the patient's condition. This approach aligns with ethical principles of beneficence and non-maleficence by ensuring the patient receives the most effective and least harmful care. An incorrect approach that relies solely on the most obvious symptom without a broader differential diagnosis would be a significant regulatory and ethical failure. This could lead to misdiagnosis, delayed treatment of underlying conditions, and potential harm to the patient, violating the APEN duty of care and professional accountability. Similarly, an approach that dismisses the patient's reported symptoms due to a history of non-adherence without objective investigation constitutes a failure to uphold the principle of patient advocacy and can lead to diagnostic overshadowing. This is ethically problematic as it prejudices the assessment and can result in substandard care. Furthermore, failing to consult with or refer to other healthcare professionals when indicated, based on the complexity of the case or the limitations of the APEN expertise, would be a breach of professional responsibility and potentially a violation of scope of practice regulations. The professional decision-making process for similar situations should involve a structured approach. 1. Gather comprehensive data, history, physical, psychosocial. 2. Formulate a broad differential diagnosis. 3. Prioritize diagnostic tests and interventions based on acuity and likelihood. 4. Reevaluate the patient's condition and diagnostic hypotheses as new information emerges. 5. Consult with colleagues or specialists when necessary. 6. Document the assessment, diagnosis, and treatment plan meticulously, reflecting the rationale for decisions. This systematic process ensures that all relevant factors are considered, leading to a more accurate and patient-centered diagnosis. Question 3. Examination of the data shows a 55-year-old female presenting with a 3-month history of increasing fatigue, intermittent mid-epigastric discomfort that is sometimes relieved by antacids, and a recent change from daily bowel movements to alternating constipation and diarrhea. She denies any unintentional weight loss, rectal bleeding, or fever. Her past medical history includes hypertension managed with lisinopril and hyperlipidemia treated with atorvastatin. She denies a history of gastrointestinal surgeries or known gastrointestinal diseases. Which of the following comprehensive health assessment techniques is most appropriate as the initial step in evaluating this patient's complex presentation? Option A. Ordering a broad panel of laboratory tests including complete blood count, comprehensive metabolic panel, and stool occult blood test without a preceding detailed history or physical examination. Option B. Immediate referral to a gastroenterologist for endoscopic evaluation based on the reported bowel habit changes. Option C. A detailed history of present illness, including symptom characteristics, aggravating and alleviating factors, associated symptoms, and temporal patterns, followed by a comprehensive physical examination focusing on the gastrointestinal system and a thorough review of systems. Option D. A focused assessment of the patient's stress levels and coping mechanisms, assuming the symptoms are psychosomatic given the absence of alarm symptoms. Correct answer is C. A detailed history of present illness, including symptom characteristics, aggravating and alleviating factors, associated symptoms, and temporal patterns, followed by a comprehensive physical examination focusing on the gastrointestinal system and a thorough review of systems. Explanation. Scenario analysis. This scenario presents a common challenge for advanced practice registered nurses, APN, in a primary care setting, discerning the underlying cause of a patient's vague symptoms. The patient's presentation of fatigue, intermittent abdominal discomfort, and changes in bowel habits is nonspecific, requiring a systematic and comprehensive approach to differentiate between common gastrointestinal issues, systemic diseases, or even psychological factors. The challenge lies in avoiding premature diagnostic conclusions and ensuring all relevant data is gathered and interpreted accurately within the scope of APN practice. Correct approach analysis. A comprehensive health assessment including a detailed history of present illness, past medical history, family history, social history, and a thorough review of systems is paramount. This is followed by a physical examination tailored to the reported symptoms, focusing on the abdominal region, but also including general appearance, vital signs, and relevant systems. The correct approach involves utilizing advanced assessment skills to gather objective and subjective data, which then informs the selection of appropriate diagnostic tests and differential diagnoses. This aligns with the APN role in independent assessment, diagnosis, and management, as outlined by the insert-specific U.S. State APN Practice Act or relevant federal guideline, e.g., Nurse Practice Act of State Name, or ACNM Standards of Practice. Ethical practice mandates a thorough investigation to ensure patient safety and provide evidence-based care. Incorrect approach is analysis. Focusing solely on the abdominal discomfort and ordering extensive gastrointestinal imaging without a complete history or physical examination would be a failure to conduct a comprehensive assessment. This approach risks missing other potential etiologies and is inefficient, potentially leading to unnecessary patient exposure to radiation and increased healthcare costs, violating principles of prudent resource utilization and patient-centered care. Dismissing the symptoms as likely stress-related without a thorough physical and systemic review would be a premature judgment. While psychological factors can manifest physically, an APN must rule out organic causes first. This approach could lead to a misdiagnosis of a serious underlying condition, representing a significant ethical and professional failure to provide adequate care. Relying exclusively on a single diagnostic test, such as a basic blood panel, without a structured assessment process is insufficient. While blood work is a component of assessment, it is not a substitute for the systematic gathering of subjective and objective data that forms the foundation of a differential diagnosis. This approach lacks the depth required for accurate diagnosis and could lead to diagnostic errors. Professional reasoning. The professional decision-making process for an APN in this situation involves a cyclical approach. 1. Elicit comprehensive subjective data through detailed history taking. 2. Perform a targeted, yet thorough, objective physical examination. 3. Synthesize subjective and objective data to formulate a list of differential diagnoses. 4. Select appropriate diagnostic tests based on the differential diagnosis and the patient's presentation, adhering to evidence-based guidelines and the scope of practice. 5. Interpret diagnostic findings in conjunction with the clinical picture to arrive at a diagnosis and develop a management plan. 6. Continuously reassess and refine the diagnosis and plan as new information becomes available. This systematic process ensures that patient care is safe, effective, and ethically sound, adhering to professional standards and regulatory requirements. Question 4. Strategic planning requires an advanced practice registered nurse APN to consider how to respond when a competent adult patient, fully informed of the risks and benefits, refuses a medically recommended treatment that the APN believes is essential for the patient's well-being. Which of the following actions best upholds the APN ethical and legal obligations? Option A. Consult with a physician to override the patient's decision, as the APN believes the patient is making a poor choice. Option B. Document the patient's refusal and the rationale provided, ensure the patient understands the potential consequences of their decision, and explore alternative care options or supportive measures. Option C. Proceed with the recommended treatment, explaining to the patient that their refusal cannot be honored due to the severity of their condition. Option D. Immediately discharge the patient from care, citing their non-compliance with medical recommendations. The correct answer is B. Document the patient's refusal and the rationale provided, ensure the patient understands the potential consequences of their decision, and explore alternative care options or supportive measures. Explanation. The scenario presents a common ethical and legal challenge for advanced practice registered nurses, APN, involving patient autonomy, informed consent, and the scope of practice within a specific regulatory framework. The APN must navigate the patient's right to refuse treatment, even if that refusal is perceived as detrimental to their health, while also adhering to legal and ethical obligations regarding patient care and professional conduct. The challenge lies in balancing the APN professional judgment and duty of care with the patient's fundamental right to self-determination. The correct approach prioritizes patient autonomy and informed consent, which are cornerstones of ethical healthcare practice and are often codified in nursing practice acts and professional ethical guidelines. This approach involves a thorough assessment of the patient's decision-making capacity, clear and comprehensive communication of risks and benefits, and exploration of alternatives, all while respecting the patient's ultimate decision. This aligns with the principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. But crucially, it upholds respect for persons and their autonomy. An incorrect approach that involves overriding the patient's decision without a clear legal or ethical justification, such as a documented finding of incapacity, would violate the principle of patient autonomy and potentially constitute battery or professional misconduct. Another incorrect approach, such as abandoning the patient due to their refusal of recommended treatment, would violate the duty of care and the ethical obligation to provide appropriate support and follow-up, potentially leading to patient harm and professional sanctions. Failing to adequately assess the patient's capacity or provide sufficient information for informed consent also represents a significant ethical and legal failing, undermining the validity of the consent process. Professionals should employ a decision-making framework that begins with a comprehensive assessment of the patient's condition and decision-making capacity. This is followed by open and honest communication, ensuring the patient understands the implications of their choices. If capacity is questionable, a formal assessment process should be initiated. The APN should explore the patient's reasoning, address any barriers to understanding or compliance, and offer alternative treatment options or supportive care. Throughout this process, documentation of all assessments, discussions, and decisions is critical for legal and ethical accountability. Question 5. To address the challenge of a patient with a previously documented advance directive expressing a desire to avoid aggressive interventions, who now presents with acute respiratory distress and appears to be struggling to communicate their current wishes, which clinical decision-making model best guides the APN actions? Option A. A model that strictly adheres to the advance directive, initiating comfort measures only and refraining from any further diagnostic or therapeutic interventions, regardless of the patient's current physiological state. Option B. a model that relies solely on the app and personal interpretation of the patient's nonverbal cues and the presumed intent of the advance directive to make unilateral decisions about care. Option C, a model that prioritizes immediate aggressive resuscitation efforts based on the acute physiological distress, deferring any discussion of the advance directive or patient preferences until the patient is stabilized. Option D, a model that emphasizes a thorough reassessment of the patient's current clinical status, consultation with the ethics committee and palliative care team, and a facilitated discussion with the patient's designated healthcare proxy to interpret the advance directive in light of the current emergent situation. The correct answer is D, a model that emphasizes a thorough reassessment of the patient's current clinical status, consultation with the ethics committee and palliative care team, and a facilitated discussion with the patient's designated healthcare proxy to interpret the advance directive in light of the current emergent situation. Explanation: this scenario presents a professionally challenging situation for an advanced practice registered nurse, APN, due to the inherent ambiguity and potential for harm when a patient's stated preferences conflict with emerging clinical data. The APN must navigate the ethical imperative to respect patient autonomy while upholding the professional duty to provide safe and effective care based on evidence. The challenge lies in discerning when a patient's expressed wishes, particularly in the context of a potentially deteriorating condition, are still the guiding principle for care, and when clinical judgment necessitates a deviation to prevent adverse outcomes. This requires a nuanced application of clinical decision-making models that integrate patient values with objective clinical assessment. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and patient-centered decision-making process. It involves a thorough reassessment of the patient's condition, consultation with relevant resources, and open communication with the patient and their family. This aligns with regulatory frameworks that mandate APN to practice within their scope, utilize critical thinking, and advocate for patient well-being. Ethically, it upholds principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, while still striving to respect autonomy through shared decision-making. The process emphasizes a collaborative approach, ensuring that any deviation from the initial plan is well justified and transparent. An incorrect approach that relies solely on the initial patient directive without reevaluation fails to acknowledge the dynamic nature of clinical conditions and the APN responsibility to adapt care plans based on evolving data. This could lead to patient harm, violating the principle of non-maleficence and potentially breaching regulatory requirements for competent practice. Another incorrect approach that unilaterally overrides the patient's wishes without adequate justification or communication demonstrates a failure to respect patient autonomy and could be considered paternalistic, undermining the therapeutic relationship and potentially violating ethical guidelines for informed consent and shared decision-making. A third incorrect approach that involves delaying critical decisions due to indecision or lack of a structured framework also poses a risk of harm, as timely interventions are often crucial in managing acute or changing patient conditions. This reflects a failure in professional accountability and adherence to standards of care. Professionals should utilize a structured clinical decision-making framework, such as a modified version of the nursing process: assessment, diagnosis, planning, implementation, evaluation, integrated with ethical decision-making models. This involves actively gathering data, analyzing it critically, considering ethical principles and patient values, exploring alternative actions, implementing the chosen course, and evaluating its effectiveness. Open communication, interprofessional collaboration, and a commitment to continuous learning are essential components of this process. Question 6. Analysis of a scenario where a patient requires management of chronic hypertension and diabetes, as well as prenatal care for a low-risk pregnancy. Which type of advanced practice registered nurse, APN, is most appropriately equipped and legally authorized to manage all three aspects of this patient's care within a single practice setting, considering their distinct educational preparation and scope of practice? Option A, a certified nurse midwife CNM. Option B, a certified registered nurse anesthetist CRNA. Option C, a certified nurse practitioner CNP with a family practice focus. Option D, a clinical nurse specialist CNS in adult health. Correct answer is C, A certified nurse practitioner, CNP, with a family practice focus. Explanation. This scenario presents a professional challenge due to the need to accurately identify the scope of practice and regulatory oversight for different advanced practice registered nurse (APN) roles. Misidentifying an APN role can lead to inappropriate delegation, scope of practice violations, and potential patient harm, all of which carry significant regulatory and ethical implications. Careful judgment is required to align patient needs with the specific competencies and legal standing of each APN type. The correct approach represents best professional practice because it accurately categorizes the APN based on their educational preparation and scope of practice as defined by the relevant regulatory body. In the U.S., the Nurse Practice Act of each state, along with National APN Consensus Model Guidelines, dictates the distinct roles of certified nurse practitioners, CNP, certified nurse midwives, CNM, certified registered nurse anesthetists, CRNA, and clinical nurse specialists, CNS. Recognizing these distinctions ensures that patient care is delivered by the APN best qualified and legally authorized to provide it, adhering to standards of care and patient safety. An incorrect approach that misclassifies a CNP as a CRNA would be a significant regulatory failure. This would violate the Nurse Practice Act by allowing an individual to practice outside their authorized scope, potentially leading to unsafe anesthesia administration. Ethically, this constitutes a breach of professional responsibility and patient trust. Similarly, mistaking a CNS for a CNM would fail to recognize the distinct roles. A CNS typically focuses on system-level improvements and direct patient care within a specialty, while a CNM provides comprehensive care for women throughout their reproductive lives. Practicing outside these defined roles is a violation of professional licensure and ethical obligations. Professionals should employ a decision-making framework that begins with understanding the patient's needs and then identifying the APN role that aligns with those needs and the APN-specific licensure and scope of practice. This involves consulting state nurse practice acts, professional organization guidelines, and the APN-owned credentials. When in doubt, seeking clarification from the State Board of Nursing or experienced APN mentors is crucial. Question 7. Strategic planning requires an advanced practice registered nurse to effectively assess a patient presenting with symptoms of a chronic illness, where the patient's cultural background includes deeply ingrained beliefs about the spiritual origins of illness and traditional healing practices. The APN must determine the most appropriate initial approach to ensure comprehensive and culturally sensitive care. Which of the following represents the most ethically and regulatorily sound initial approach? Option A. Initiate a discussion to understand the patient's beliefs about their illness, explore how these beliefs influence their health practices, and collaboratively develop a care plan that integrates their cultural understanding with evidence-based medical recommendations. Option B. Acknowledge their beliefs but proceed with the standard medical assessment and treatment plan, deferring any discussion of cultural practices until after the immediate medical needs are addressed. Option C. Gently explain that while their beliefs are noted, the focus must remain on scientifically proven medical treatments to ensure the best possible outcome. Option D. Proceed with a standard medical assessment and treatment plan, assuming that the patient will eventually adhere to the prescribed regimen once they understand its necessity. The correct answer is A. Initiate a discussion to understand the patient's beliefs about their illness, explore how these beliefs influence their health practices, and collaboratively develop a care plan that integrates their cultural understanding with evidence-based medical recommendations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the APN to navigate a patient's deeply held cultural beliefs that may conflict with standard Western medical practices. The APN must balance the patient's autonomy and cultural identity with the imperative to provide safe and effective care. Failure to do so can lead to mistrust, non-adherence, and potentially adverse health outcomes, while also violating ethical principles of respect and beneficence. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing open communication, active listening, and a collaborative approach to care planning. This aligns with regulatory frameworks that emphasize patient-centered care, informed consent, and the ethical obligation to respect patient values and beliefs. Specifically, it upholds the principles of autonomy, respecting the patient's right to make decisions based on their beliefs and beneficence, working towards the patient's well-being within their cultural context. This approach fosters trust and ensures that the care plan is not only medically sound, but also culturally acceptable and therefore more likely to be followed. Incorrect approach is analysis, an approach that dismisses or minimizes the patient's cultural beliefs as irrelevant or superstitious, represents a failure in cultural competence. This violates ethical principles of respect for persons and can lead to discriminatory practices, which are often prohibited by professional codes of conduct and may have legal ramifications. It also undermines the therapeutic relationship, making the patient less likely to engage in care. An approach that imposes the APAN own cultural understanding of health and illness, without seeking to understand the patient's perspective, is also ethically and regulatorily unsound. This demonstrates ethnocentrism and a lack of cultural humility, leading to a misdiagnosis or inappropriate treatment plan. It disregards the patient's lived experience and can result in significant harm. An approach that focuses solely on the biomedical aspects of the illness, ignoring the patient's expressed cultural needs and practices, fails to provide holistic care. This is contrary to the comprehensive scope of practice for APAN, which includes addressing the psychosocial and cultural determinants of health. It can lead to a fragmented care experience and a failure to address the patient's overall well-being. Professional reasoning. Professionals should employ a decision-making framework that begins with acknowledging and validating the patient's cultural background. This involves active listening, asking open-ended questions to understand their beliefs, values, and practices related to health and illness, and seeking clarification. The next step is to integrate this understanding into the assessment and care planning process, identifying potential areas of conflict or synergy between cultural beliefs and medical recommendations. Finally, the APAN should engage in shared decision-making, collaboratively developing a care plan that respects the patient's cultural identity while ensuring their safety and promoting optimal health outcomes. This iterative process of understanding, integrating, and collaborating is crucial for effective and ethical APAN practice. Question 8. The control framework reveals that an advanced practice registered nurse, APAN, is conducting a comprehensive history on a new patient presenting with vague somatic complaints. The APAN suspects potential underlying psychosocial stressors that could be contributing to the patient's presentation and are relevant to a thorough risk assessment, which approach to history taking best aligns with regulatory requirements and ethical best practices for risk assessment in this context. Option A. Systematically inquire about potential stressors and risk factors in a calm, non-judgmental manner, explaining the relevance of these questions to understanding their overall health and safety, while being attentive to the patient's comfort and willingness to share. Option B. Rapidly ask a broad range of direct questions about sensitive topics to quickly identify any potential risks, assuming the patient understands the necessity of such directness. Option C. Rely primarily on information from the patient's previous medical records and family members to piece together a picture of potential risks, minimizing direct questioning about sensitive personal matters. Option D. Focus exclusively on the physical symptoms presented, deferring any exploration of psychosocial factors unless the patient explicitly volunteers them, to avoid making the patient uncomfortable. The correct answer is A. Systematically inquire about potential stressors and risk factors in a calm, non-judgmental manner, explaining the relevance of these questions to understanding their overall health and safety, while being attentive to the patient's comfort and willingness to share. Explanation. This scenario is professionally challenging because the APAN must balance the immediate need for information to assess risk with the patient's potential vulnerability and right to privacy. The APAN approach to history taking directly impacts the quality of the risk assessment, patient trust, and adherence to regulatory and ethical standards governing patient care and data collection. The correct approach represents best professional practice because it prioritizes a patient-centered, trauma-informed, and legally compliant method of history-taking. This involves establishing rapport, explaining the purpose of the questions, and obtaining informed consent where applicable, aligning with the Nurse Practice Act and ethical codes that mandate patient autonomy, beneficence, and non-maleficence. A comprehensive yet sensitive approach ensures that all relevant risk factors are identified without causing undue distress or violating patient confidentiality, thereby facilitating effective care planning and intervention. An incorrect approach that focuses solely on rapid data acquisition without considering the patient's emotional state or context fails to meet the ethical standard of non-maleficence. It may inadvertently re-traumatize a vulnerable patient, leading to incomplete or inaccurate information and potentially harming the therapeutic relationship. This approach could also violate regulations concerning patient privacy and dignity if sensitive information is solicited insensitively or without clear justification. Another incorrect approach that avoids asking potentially sensitive but critical questions due to discomfort or time constraints directly contravenes the APN duty of beneficence and due diligence in risk assessment. Failure to gather necessary information can lead to an incomplete risk assessment, potentially resulting in missed opportunities for intervention and increased risk to the patient. It may also fall short of the professional standards of care expected in comprehensive history taking. A third incorrect approach that relies heavily on assumptions or third-party information without direct patient engagement, unless legally mandated or in emergent situations, undermines patient autonomy and the principle of obtaining direct consent for information gathering. This can lead to misinterpretations, incomplete data, and a breakdown in the patient-provider relationship, potentially violating privacy regulations and ethical obligations to the patient. The professional decision-making process for similar situations should involve a systematic approach. 1. Assess the immediate clinical situation and potential risks. 2. Prioritize information gathering based on urgency and relevance to patient safety. 3. Employ communication techniques that build rapport and trust, such as active listening and empathetic responses. 4. Clearly explain the purpose of sensitive questions and obtain consent where appropriate. 5. Be mindful of the patient's emotional state and adjust the approach accordingly. 6. Document all information gathered and the rationale for the approach taken, ensuring compliance with all applicable regulations and ethical guidelines. Question 9. What factors determine the optimal selection of an imaging study for an advanced practice registered nurse to order for a patient presenting with acute abdominal pain, considering diagnostic accuracy, patient safety, and resource utilization? Option A. The imaging study most frequently ordered by other healthcare providers in the facility for similar complaints. Option B. The patient's explicit request for a specific type of imaging, regardless of clinical indication. Option C. The lowest cost imaging modality available, irrespective of its diagnostic efficacy for the suspected condition. Option D. The patient's presenting signs and symptoms, relevant medical history, and the differential diagnosis established through clinical assessment. The correct answer is D. The patient's presenting signs and symptoms, relevant medical history, and the differential diagnosis established through clinical assessment. Explanation. This scenario presents a professional challenge for an advanced practice registered nurse, APN, in determining the most appropriate imaging study for a patient. The challenge lies in balancing the need for accurate diagnosis with patient safety, resource utilization, and adherence to evidence-based practice guidelines, all within the regulatory framework governing APN practice. Careful judgment is required to avoid unnecessary radiation exposure, minimize patient discomfort, and ensure cost-effectiveness while still achieving diagnostic certainty. The correct approach represents best professional practice because it prioritizes a comprehensive clinical assessment to guide imaging selection. This aligns with the APN scope of practice, which mandates that diagnostic decisions be based on a thorough understanding of the patient's history, physical examination findings, and differential diagnoses. Regulatory frameworks for APN typically emphasize patient-centered care, evidence-based decision-making, and the judicious use of diagnostic tools. Selecting an imaging study that directly addresses the most likely diagnoses, considering factors like radiation dose and patient contraindications, is ethically and professionally sound. This approach ensures that the chosen modality is both effective and appropriate for the individual patient's clinical presentation, thereby optimizing outcomes and minimizing risks. An incorrect approach that relies solely on patient request for a specific imaging modality without independent clinical evaluation is professionally unacceptable. This fails to uphold the APN responsibility to provide expert clinical judgment and could lead to inappropriate testing, unnecessary costs, and potential patient harm from radiation exposure or false positives. Ethically, it deviates from the principle of beneficence and non-maleficence. Another incorrect approach that prioritizes the least expensive imaging study, regardless of diagnostic yield, ignores the primary goal of accurate diagnosis and patient well-being potentially leading to delayed or misdiagnoses, which is a failure of professional duty. A third incorrect approach that selects an imaging study based on physician preference without considering the app's own assessment or established guidelines disregards the collaborative nature of care and the app's autonomous role in diagnostic decision-making, potentially leading to suboptimal patient care. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough patient assessment, including history and physical examination. 2. Develop a prioritized differential diagnosis. 3. Consult evidence-based practice guidelines and current literature for recommended imaging modalities for the suspected conditions. 4. Consider patient-specific factors such as age, comorbidities, allergies, pregnancy status, and contraindications to specific imaging agents or procedures. 5. Evaluate the risks and benefits of each potential imaging study, including radiation exposure, cost, and diagnostic accuracy. 6. Discuss imaging options with the patient, incorporating their preferences and concerns while providing expert guidance. 7. Document the rationale for the chosen imaging study. Question 10. Governance review demonstrates a need to clarify the foundational understanding of advanced practice registered nursing, APN roles within the organization. Which of the following best defines the core concept of APN practice according to established regulatory frameworks? Option A. APN practice encompasses all healthcare providers with a graduate degree who provide direct patient care, regardless of their specific professional discipline or licensure. Option B. APN practice is primarily determined by the clinical setting in which the provider works, allowing for a flexible scope of practice based on institutional needs. Option C. APN practice is equivalent to physician practice, with APN performing the same diagnostic and therapeutic functions under the same regulatory oversight as physicians. Option D. APN practice is characterized by distinct educational preparation, national certification, and a defined scope of practice specific to a particular role, e.g., nurse practitioner, certified registered nurse anesthetist, and population focus, all regulated under state nursing practice acts. The correct answer is D. APN practice is characterized by distinct educational preparation, national certification, and a defined scope of practice specific to a particular role, e.g., nurse practitioner, certified registered nurse anesthetist, and population focus, all regulated under state nursing practice acts. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the APN to navigate the evolving landscape of advanced practice nursing roles and responsibilities, particularly concerning the scope of practice and the distinction between different APN roles. Misunderstanding these definitions can lead to scope of practice violations, patient safety risks, and professional disciplinary action. Careful judgment is required to accurately identify the core competencies and regulatory definitions of each APN role. Correct approach analysis. The correct approach accurately reflects the established definitions and regulatory frameworks for advanced practice registered nursing. It emphasizes the distinct educational preparation, scope of practice, and licensure requirements that differentiate APN roles such as nurse practitioners, certified nurse midwives, certified registered nurse anesthetists, and clinical nurse specialists. This aligns with the regulatory framework for APN, which mandates that practice is based on specific graduate-level education and national certification in a particular role and population focus. Adhering to these definitions ensures that APN practice within their legally defined scope, promoting patient safety and maintaining professional accountability. Incorrect approach is analysis, an approach that conflates all APN roles into a single, undifferentiated category fails to recognize the specific educational pathways, national certifications, and distinct scopes of practice that define each APN role. This is a regulatory failure as it ignores the legal and professional distinctions established by licensing boards and certifying bodies. Ethically, it risks assigning responsibilities to an APN that they are not educated, certified, or licensed to perform, potentially compromising patient care. An approach that defines APN practice solely by the setting in which they work, rather than their specific role and population focus, is also incorrect. While practice settings influence the application of skills, they do not define the fundamental nature of an APN role. This is a regulatory misinterpretation, as APN licensure and scope are tied to their role e.g., NP, CRNA, and population e.g., family, pediatric, adult gerontology, not just the hospital or clinic environment. An approach that equates APN practice with that of a physician, without acknowledging the unique educational preparation, theoretical underpinnings, and regulatory oversight specific to nursing, is a significant mischaracterization. While APN often collaborate with physicians and may perform similar functions, their practice is rooted in nursing theory and is regulated under Nursing Practice Acts. This represents a failure to adhere to the distinct regulatory framework governing nursing practice and advanced practice nursing. Professional reasoning. Professionals should employ a decision-making framework that begins with understanding the specific regulatory definitions and scope of practice for each APN role, as defined by their state's Nurse Practice Act and relevant national certifying bodies. This involves consulting official documents, seeking clarification from regulatory bodies when necessary, and engaging in continuous professional development to stay abreast of evolving practice standards. When faced with ambiguity, the principle of practicing within one's documented education, certification, and licensure is paramount. Question 11. Regulatory review indicates that an advanced practice registered nurse (APN) is managing a patient experiencing moderate to severe acute pain. The patient reports taking several over-the-counter medications, including a common herbal supplement known to interact with certain analgesics. The APN is considering prescribing a Schedule Roman II opioid analgesic for pain relief. Which of the following actions represents the most appropriate and compliant approach for the APN? Option A. Conduct a thorough medication reconciliation, assess the patient's pain etiology, and consult drug interaction resources to determine the safest and most effective analgesic option. Option B. Immediately prescribe the Schedule Roman II opioid analgesic without further investigation, prioritizing rapid pain relief. Option C. Refuse to prescribe any opioid analgesic due to the presence of the herbal supplement, recommending non-pharmacological pain management exclusively. Option D. Prescribe the Schedule Roman II opioid analgesic at a standard starting dose, advising the patient to report any unusual side effects. Correct answer is D. Prescribe the Schedule Roman II opioid analgesic at standard starting dose, advising the patient to report any unusual side effects. Explanation. Scenario analysis. This scenario presents a common yet complex clinical challenge for an advanced practice registered nurse (APN). The APN must balance the patient's immediate need for pain relief with the potential for adverse drug interactions and the need to adhere to established prescribing guidelines and best practices. The challenge lies in accurately assessing the patient's current medication regimen, understanding the pharmacological properties of both the prescribed and over-the-counter medications, and making an informed therapeutic decision that prioritizes patient safety and efficacy. This requires a deep understanding of pharmacodynamics, pharmacokinetics, and potential drug-drug interactions, all within the scope of APN practice as defined by regulatory frameworks. Correct approach analysis. The correct approach involves a comprehensive review of the patient's current medication list, including all prescription, over-the-counter, and herbal supplements. This is followed by a thorough assessment of the patient's pain level and the underlying cause of the pain. The APN then consults reliable drug interaction databases and relevant clinical guidelines to evaluate the safety and efficacy of adding a new opioid analgesic. This systematic, evidence-based approach ensures that the APN is making a decision that is both clinically sound and compliant with regulatory requirements for safe prescribing, prioritizing patient well-being, and minimizing the risk of harm. This aligns with the APN responsibility to provide safe, competent, and ethical care. Incorrect approaches analysis. One incorrect approach involves immediately prescribing a potent opioid analgesic without a thorough medication reconciliation or assessment of potential drug interactions. This fails to meet the standard of care and regulatory expectations for safe medication management, potentially leading to serious adverse events such as serotonin syndrome or enhanced central nervous system depression. This demonstrates a failure in the APN duty to assess and plan care comprehensively. Another incorrect approach is to dismiss the patient's pain as non-significant or to refuse any pain management without a clear, documented rationale based on the patient's clinical presentation and medication profile. This could be considered a failure to adequately manage pain, which is a core component of APN practice, and may violate ethical principles of beneficence and non-maleficence. It also neglects the regulatory requirement to provide appropriate care within the APN scope. A third incorrect approach is to rely solely on the patient's self-report of their medication list without independent verification, especially when considering the addition of a new, potentially interacting medication. This oversight can lead to critical omissions in the medication history, increasing the risk of prescribing an unsafe combination of drugs. This represents a lapse in due diligence and a failure to adhere to best practices in medication reconciliation. Professional reasoning. When faced with a patient requiring pain management, the APN should employ a structured decision-making process. This begins with a comprehensive patient assessment, including a detailed history of present illness, past medical history, and a complete medication reconciliation. The APN should then identify potential therapeutic goals and pharmacologic options, considering the patient's specific condition and comorbidities. Crucially, the APN must consult evidence-based resources to identify potential drug-drug interactions, contraindications, and appropriate dosing guidelines. The final decision should be a collaborative one, involving the patient where appropriate, and should be clearly documented in the patient's record, including the rationale for the chosen therapeutic intervention. This systematic approach ensures patient safety, therapeutic efficacy, and regulatory compliance. Question 12. The audit findings indicate that an advanced practice registered nurse, APN, in a critical care setting, received a verbal order from a physician to initiate a medication that the APN believes falls outside of their independently recognized scope of practice, as defined by the state's Nurse Practice Act. The APN has reviewed the relevant sections of the Act and feels the order requires physician oversight beyond what is typically permitted for their licensure level. What is the most appropriate course of action for the APN? Option A. Administer the medication while privately noting their discomfort in their personal journal, but not formally documenting any concerns or seeking clarification through official channels. Option B. Consult the state's Nurse Practice Act and relevant Board of Nursing guidelines to confirm their scope of practice regarding the specific medication and order. Document this consultation and their findings, and then communicate their findings and proposed course of action to the ordering physician. Option C. Refuse to administer the medication and inform the physician that they are unwilling to proceed without further clarification, without consulting any regulatory documents. Option D. Immediately administer the medication as ordered by the physician to ensure timely patient care and avoid potential conflict. The correct answer is B. Consult the state's Nurse Practice Act and relevant Board of Nursing guidelines to confirm their scope of practice regarding the specific medication and order. Document this consultation and their findings, and then communicate their findings and proposed course of action to the ordering physician. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a direct conflict between a physician's directive and the advanced practice registered nurses, APN, understanding of their state's scope of practice. The APN must navigate potential professional repercussions from the physician while upholding patient safety and adhering to legal and regulatory boundaries. The challenge lies in asserting professional autonomy and expertise without creating an irreconcilable conflict. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and adherence to state regulations. By consulting the Nurse Practice Act and relevant state Board of Nursing guidelines, the APN is actively seeking to understand the legal and regulatory framework governing their practice. This proactive step ensures that their decision is grounded in established law, not personal opinion or physician preference. Documenting the consultation and the rationale for their decision is crucial for accountability and legal protection. This approach demonstrates professional integrity and a commitment to practicing within the defined scope, which is paramount for APN licensure and patient well-being. Incorrect approaches analysis. One incorrect approach involves immediately complying with the physician's directive without question. This fails to uphold the APN professional responsibility to practice within their scope of practice as defined by the Nurse Practice Act. It could lead to practicing outside of legal boundaries, potentially endangering the patient and exposing the APN to disciplinary action. This approach also undermines the collaborative nature of healthcare by deferring professional judgment solely to another provider, regardless of their scope. Another incorrect approach is to refuse the physician's directive outright without any attempt at clarification or consultation. While the APN may be correct in their assessment of scope limitations, A confrontational refusal without seeking understanding or exploring alternatives can damage the interprofessional relationship and hinder effective patient care. It lacks the professional diplomacy required to resolve such conflicts and may be perceived as insubordination rather than professional adherence to regulations. A third incorrect approach is to proceed with the physician's directive while privately feeling uncomfortable, but not taking any formal steps to verify or document their concerns. This approach is ethically and legally problematic. It creates a situation where the applicant is practicing outside their perceived scope, potentially violating regulations, and lacks the necessary documentation to defend their actions if questioned. This passive approach fails to protect the patient or the applicant. Professional reasoning. Professionals facing this situation should employ a structured decision-making process. First, identify the core issue, a potential conflict between a directive and the applicant's scope of practice. Second, consult authoritative sources, such as the state's Nurse Practice Act, Board of Nursing Regulations, and professional practice guidelines, to clarify the applicant-authorized actions. Third, if clarification is needed or a conflict persists, engage in open and respectful communication with the ordering physician to discuss concerns and explore alternative, legally permissible approaches to patient care. Fourth, document all consultations, decisions, and rationale thoroughly. If the conflict cannot be resolved through direct communication, escalate the issue through appropriate organizational channels or consult with the State Board of Nursing for guidance. This process ensures patient safety, regulatory compliance, and professional accountability. Question 13. Compliance review shows a CRNA is preparing to administer anesthesia for a scheduled surgical procedure. During the pre-anesthetic assessment, the CRNA identifies a new finding in the patient's medical history that was not present in the initial preoperative evaluation. What is the most appropriate course of action for the CRNA? Option A. Immediately cancel the surgical procedure and inform the patient that it cannot proceed due to the new finding. Option B. Proceed with the original anesthetic plan as it was approved prior to the discovery of the new information. Option C. Reevaluate the patient's current condition. Consult with the surgical team regarding the impact of the new finding on the anesthetic plan, and document all findings and decisions. Option D. Administer a different anesthetic agent than originally planned without consulting the surgical team. The correct answer is C. Reevaluate the patient's current condition. Consult with the surgical team regarding the impact of the new finding on the anesthetic plan, and document all findings and decisions. Explanation. This scenario presents a professional challenge because it requires the Certified Registered Nurse Anesthetist, CRNA, to balance patient safety, adherence to established protocols, and the potential for emergent situations that may necessitate deviation from standard practice. The CRNA must exercise sound clinical judgment, informed by their scope of practice and understanding of anesthetic principles, while also ensuring all actions are justifiable and documented. The correct approach represents best professional practice because it prioritizes patient safety through a systematic and evidence-based evaluation of the patient's condition and the proposed anesthetic plan. This approach aligns with the ethical principles of beneficence and non-maleficence, ensuring that the CRNA acts in the patient's best interest and avoids harm. Furthermore, it reflects a commitment to professional accountability and the maintenance of high standards of care, as expected within the regulatory framework governing advanced practice registered nursing. An incorrect approach that involves proceeding with the anesthetic without a thorough assessment of the new information would be a significant regulatory and ethical failure. This would violate the principle of non-maleficence by potentially exposing the patient to undue risk. It also demonstrates a lack of professional diligence and a failure to uphold the CRNA responsibility to provide individualized care based on the most current patient data. Another incorrect approach, such as unilaterally altering the anesthetic plan without consulting the surgeon or anesthesiologist, could lead to a breakdown in team communication and potentially compromise patient safety due to a lack of coordinated care, violating principles of collaborative practice, and potentially exceeding the CRNA-defined scope of independent practice in certain contexts. A third incorrect approach, such as delaying the procedure indefinitely without clear justification, could also be problematic, potentially impacting patient outcomes and resource utilization, and failing to demonstrate appropriate clinical decision-making in a timely manner. Professionals should employ a decision-making framework that begins with a comprehensive assessment of the patient, followed by a critical evaluation of any new information or changes in the patient's status. This should include consulting relevant literature, established protocols, and collaborating with the healthcare team, including the surgeon and other physicians. Documentation of all assessments, decisions, and communications is paramount. This systematic approach ensures that care is evidence-based, patient-centered, and compliant with professional standards and regulatory requirements. Question 14. The risk matrix shows a high probability of a patient experiencing a critical adverse event if immediate advanced practice interventions are not initiated. However, the APN reviewing the matrix has a nagging concern that their national certification for their specialty may have lapsed due to an administrative oversight in renewing their continuing education credits. They are the only APN immediately available to provide the necessary care. What is the most ethically and legally sound course of action for the APN? Option A. Immediately initiate the advanced practice interventions to stabilize the patient, and then address the certification renewal process as soon as possible afterward. Option B. Proceed with the advanced practice interventions, assuming the lapse is minor and will be easily rectified, and inform the patient's family of the potential certification issue after the immediate crisis has passed. Option C. Delegate the immediate care to the most experienced registered nurse on staff, while the APN attempts to renew their certification concurrently. Option D. Halt all advanced practice interventions and immediately contact the national certifying body and their state board of nursing to clarify their certification status and seek guidance on how to proceed. The correct answer is A. Immediately initiate the advanced practice interventions to stabilize the patient, and then address the certification renewal process as soon as possible afterward. Explanation. Scenario analysis. This scenario presents a professional challenge due to the conflict between a perceived immediate need for patient care and the strict adherence to national certification and licensure requirements. The APN is aware of a potential gap in their current certification status, which directly impacts their legal and ethical right to practice. The urgency of the patient's condition creates a strong emotional pull to act, but acting without proper authorization carries significant risks to both the APN and the patient. The core of the challenge lies in balancing the duty to care with the duty to comply with regulatory mandates, designed to ensure patient safety and professional accountability. Correct approach analysis. The correct approach prioritizes patient safety and professional integrity by immediately addressing the licensure and certification issue. This aligns with the fundamental principle of practicing within the scope of one's licensure and certification, as mandated by national standards and state nurse practice acts. By proactively seeking to rectify the situation, the APN demonstrates a commitment to ethical practice and regulatory compliance. This approach ensures that all care provided is legally sanctioned and meets the established standards of competence, thereby protecting the patient from potential harm that could arise from practice outside of authorized scope. It also safeguards the APN from legal repercussions, disciplinary action, and damage to their professional reputation. Incorrect approaches analysis. One incorrect approach involves proceeding with patient care without verifying or rectifying the certification status. This is a direct violation of national certification requirements and state licensure laws. Practicing without current, valid certification, when required for the specific role or specialty, constitutes unlicensed practice and can lead to severe penalties, including license suspension or revocation. It also exposes the patient to potential harm if the APN skills or knowledge have become outdated, or if the certification process itself is designed to ensure current competency. Another incorrect approach is to delegate the care to another provider without informing them of the potential certification issue. This is ethically problematic as it fails to ensure that the patient is receiving care from a fully qualified and authorized provider. It also places the burden of potential regulatory noncompliance on another individual and does not resolve the APN's own responsibility. Furthermore, it undermines the collaborative nature of healthcare teams by withholding critical information. A third incorrect approach is to delay addressing the certification issue until after the patient's immediate needs are met. While the intention might be to prioritize the patient, this still involves practicing outside of the established regulatory framework. The delay does not negate the fact that the APN is operating without the necessary authorization, and any adverse outcome during this period could be attributed to practicing without proper credentials, exacerbating the legal and ethical ramifications. Professional reasoning. Professionals facing such a dilemma should employ a structured decision-making process. First, they must identify the core issue, a potential discrepancy in licensure or certification. Second, they should consult relevant regulatory documents, such as their state's Nurse Practice Act and the requirements of their national certifying body, to understand the precise implications. Third, they must prioritize patient safety and legal compliance, which means halting practice that may be unauthorized until the issue is resolved. Fourth, they should seek guidance from appropriate sources, such as their employer's legal counsel, professional organization, or state board of nursing. Finally, they must take immediate action to rectify the situation, whether it involves submitting missing documentation, retaking an exam, or clarifying the scope of their current certification. This systematic approach ensures that decisions are grounded in regulatory requirements and ethical principles, protecting both the patient and the applicant. Question 15. The audit findings indicate a pattern of prescribing a specific medication for a patient population that deviates from established institutional guidelines, with a particular instance noted where an applicant prescribed a higher dosage than typically recommended without explicit documentation of the clinical justification. What is the most appropriate immediate course of action for the applicant? Option A. Immediately adjust the prescription to the standard recommended dosage without further investigation, assuming the audit finding indicates a universal error. Option B. Prescribe a different medication that falls within the standard guidelines, without consulting the supervising physician or reviewing the patient's specific clinical needs. Option C. Continue prescribing the higher dosage as it has been effective for this patient, and disregard the audit finding as it pertains to a specific instance. Option D. Review the patient's complete medical record. Consult the relevant institutional prescribing guidelines and evidence-based literature, and discuss the specific case with the supervising physician to document the rationale for the dosage prescribed. The correct answer is D. Review the patient's complete medical record, consult the relevant institutional prescribing guidelines and evidence-based literature, and discuss the specific case with the supervising physician to document the rationale for the dosage prescribed. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a potential deviation from established prescribing guidelines, raising concerns about patient safety, regulatory compliance, and professional accountability. The applicant must balance the immediate needs of the patient with the imperative to adhere to established protocols and evidence-based practice. The audit findings necessitate a proactive and thorough response to ensure that prescribing practices are safe, effective, and legally sound. Correct approach analysis. The correct approach involves a comprehensive review of the patient's chart, relevant clinical guidelines, and the specific rationale for the prescribing decision. This demonstrates a commitment to evidence-based practice and patient-centered care. By consulting with the supervising physician and documenting the rationale, the applicant upholds professional standards, ensures collaborative practice, and maintains transparency in their decision-making process, aligning with the principles of responsible prescribing and regulatory requirements for applicant practice. Incorrect approach is analysis. Prescribing a different medication without consulting the supervising physician or reviewing guidelines represents a failure to adhere to collaborative practice agreements and evidence-based prescribing. This could lead to suboptimal patient outcomes or adverse drug events, violating professional ethical obligations and potentially regulatory mandates for applicant supervision. Failing to document the rationale for the prescribing decision is a significant regulatory and ethical lapse. Proper documentation is crucial for continuity of care, legal protection, and demonstrating adherence to professional standards. Without it, the applicant cannot justify their actions if questioned, potentially leading to disciplinary action. Continuing the current prescription without further investigation, despite audit findings suggesting a potential issue, demonstrates a lack of due diligence and a disregard for patient safety and quality improvement. This passive approach fails to address the identified concern and could perpetuate a suboptimal or unsafe prescribing practice, violating the applicant duty of care. Professional reasoning. Professionals facing such situations should employ a systematic decision-making process. First, acknowledge and investigate the audit findings thoroughly. Second, review the patient's clinical data and relevant evidence-based guidelines. Third, consult with appropriate colleagues, including the supervising physician, to discuss findings and potential interventions. Fourth, document all assessments, decisions, and rationale meticulously. Finally, implement the chosen course of action and monitor patient outcomes, participating in ongoing quality improvement initiatives. Question 16. The control framework reveals an advanced practice registered nurse, APN, is managing a patient with chronic knee osteoarthritis experiencing significant pain and functional limitations. The patient desires immediate pain relief and a return to their previous level of activity, while the referring physician has expressed concerns about the long-term cost-effectiveness of aggressive interventions and suggests a more conservative approach. The patient's family is also present, advocating for a treatment plan that prioritizes the patient's comfort and quality of life above all else. Which of the following approaches best aligns with the APN professional responsibilities and the regulatory framework for advanced practice nursing? Option A. Initiate a comprehensive assessment to identify contributing factors to the pain and functional decline. Explore evidence-based pharmacological and non-pharmacological treatment options in collaboration with the patient and family, and facilitate a discussion with the referring physician to develop a mutually agreeable, patient-centered care plan that balances immediate needs with long-term goals and resource considerations. Option B. Recommend immediate surgical consultation for knee replacement, as this is the most definitive solution for severe osteoarthritis, without further exploration of conservative measures or detailed discussion of the patient's functional goals. Option C. Focus solely on educating the patient about the progressive nature of osteoarthritis and the limitations of current treatments, without actively exploring or recommending specific intervention. To manage expectations and avoid potential disappointment, Option D. Prescribe high-dose opioid analgesics to immediately address the patient's pain, as this is the primary concern expressed by the patient and their family, and defer further discussion about long-term management until the acute pain is controlled. The correct answer is A. Initiate a comprehensive assessment to identify contributing factors to the pain and functional decline. Explore evidence-based pharmacological and non-pharmacological treatment options in collaboration with the patient and family, and facilitate a discussion with the referring physician to develop a mutually agreeable, patient-centered care plan that balances immediate needs with long-term goals and resource considerations. Explanation. The control framework reveals a common challenge for advanced practice registered nurses, APN, in managing patients with complex musculoskeletal conditions, particularly when navigating differing stakeholder expectations and resource limitations. This scenario is professionally challenging because the APN must balance the patient's immediate need for pain relief and functional improvement with the long-term implications of treatment, the financial constraints of the healthcare system, and the differing perspectives of the patient, their family, and the referring physician. Careful judgment is required to ensure evidence-based practice is applied while maintaining patient-centered care and advocating for appropriate resource allocation. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary assessment and collaborative care planning. This aligns with the APN scope of practice, which mandates thorough patient evaluation, diagnosis, and development of a treatment plan. By involving the patient and family in shared decision-making, the APN upholds ethical principles of autonomy and beneficence. Consulting with specialists and considering evidence-based guidelines ensures the plan is safe, effective, and aligned with current standards of care, thereby fulfilling regulatory requirements for competent practice and patient safety. An incorrect approach that focuses solely on immediate pain management without a comprehensive assessment fails to address the underlying pathology and may lead to suboptimal long-term outcomes, potentially violating the regulatory duty to provide appropriate and evidence-based care. Another incorrect approach that dismisses the patient's concerns or family input disregards the ethical imperative of patient autonomy and shared decision-making, which are fundamental to patient-centered care and professional conduct. Furthermore, an approach that unilaterally dictates treatment without considering the referring physician's input or available resources could lead to fragmented care and potential regulatory issues related to scope of practice and interprofessional collaboration. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough history and physical examination, including a detailed musculoskeletal assessment. 2. Formulate a differential diagnosis based on the assessment findings. 3. Review relevant evidence-based guidelines and consult with specialists as needed. 4. Engage the patient and family in a discussion of diagnostic and treatment options, considering their values, preferences, and goals. 5. Develop a collaborative, individualized care plan that addresses immediate needs while planning for long-term management and rehabilitation. 6. Document all assessments, decisions, and plans meticulously. Question 17. System analysis indicates a patient with newly prescribed anticoagulation therapy presents with limited health literacy, expressing difficulty understanding complex medical information. The advanced practice registered nurse APN is preparing to educate the patient on their new medication regimen. Which of the following approaches best ensures effective patient education and promotes safe medication management in this scenario? Option A. Instructing the patient to have a family member present during future appointments to receive and relay medication instructions. Option B. Briefly stating the medication's name and dosage, assuming the patient will seek further clarification if needed. Option C. Providing a comprehensive written pamphlet detailing the medication's mechanism of action, potential side effects, and dietary interactions, and asking the patient if they have any questions. Option D. Explaining the medication's name, dosage, and frequency, and then asking the patient to explain the instructions back in their own words to confirm understanding. The correct answer is C. Providing a comprehensive written pamphlet detailing the medication's mechanism of action, potential side effects, and dietary interactions, and asking the patient if they have any questions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the APN to balance the patient's autonomy and right to informed consent with the professional responsibility to ensure safe and effective medication management. The patient's limited health literacy and potential for misunderstanding complex medication instructions present a significant barrier to effective education. The APN must assess the patient's comprehension level accurately and adapt their teaching methods accordingly, which requires strong communication and assessment skills. Failure to do so can lead to medication errors, adverse drug events, and compromised patient outcomes, all of which have significant ethical and legal implications. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient-centered care and adheres to the ethical principles of beneficence and non-maleficence. By utilizing teach-back methodology, the APN actively involves the patient in their learning process, ensuring comprehension rather than assuming understanding. This method directly addresses the patient's limited health literacy by requiring them to rephrase information in their own words, allowing the APN to identify and correct any misunderstandings immediately. This aligns with regulatory guidelines that mandate clear, understandable patient education to promote safe medication use and adherence. It empowers the patient to actively participate in their care, fostering a collaborative relationship and improving the likelihood of positive health outcomes. Incorrect approaches analysis. Providing a detailed written pamphlet without assessing comprehension fails to acknowledge the patient's stated limited health literacy. This approach is ethically problematic as it does not ensure the patient can understand or act upon the information, potentially leading to non-adherence or incorrect usage, violating the principle of beneficence. It also fails to meet regulatory requirements for effective patient education, which necessitates verification of understanding. Simply stating the medication's name and dosage without further explanation or checking for understanding is a gross dereliction of professional duty. This approach is ethically indefensible, as it neglects the core responsibility of educating a patient about their treatment, thereby increasing the risk of harm, non-maleficence. It is also a clear violation of regulatory mandates for patient education. Relying solely on the patient's family member to convey medication information without direct assessment of the patient's understanding is insufficient. While family involvement can be supportive, the APN has a direct professional obligation to educate the patient. This approach risks misinterpretation or incomplete information transfer and bypasses the patient's right to direct informed consent and education, potentially violating ethical principles and regulatory requirements for patient-specific education. Professional reasoning. When faced with a patient with limited health literacy requiring medication education, the APN should employ a systematic approach. First, assess the patient's current understanding and identify barriers to learning. Second, Use clear, simple language, avoiding medical jargon. Third, employ a variety of teaching methods such as visual aids or demonstrations, tailored to the patient's needs. Fourth, consistently use the teach-back method to confirm comprehension. Fifth, document the education provided and the patient's understanding. This iterative process ensures that education is effective, patient-centered, and compliant with professional standards and regulations. Question 18. The control framework reveals that an advanced practice registered nurse APN is evaluating a 72-year-old male patient with a history of hypertension, hyperlipidemia, and a previous myocardial infarction. The patient presents with new-onset shortness of breath and fatigue. He is currently taking lisinopril, atorvastatin, and aspirin. Which of the following approaches best represents a comprehensive risk assessment for this patient? Option A. Conduct a thorough review of the patient's cardiac history, current medications, vital signs, and perform a detailed physical examination, including lung and cardiac auscultation, to identify potential causes and contributing factors to his symptoms. Option B. Prescribe a beta blocker to manage the new symptoms, given the patient's history of myocardial infarction, without further diagnostic workup. Option C. Prioritize immediate management of the new-onset shortness of breath by initiating a diuretic, assuming fluid overload is the primary cause. Option D. Focus solely on the patient's reported shortness of breath and fatigue, ordering a chest X-ray to rule out pneumonia as the most likely cause. The correct answer is C. Prioritize immediate management of the new-onset shortness of breath by initiating a diuretic, assuming fluid overload is the primary cause. Explanation. This scenario is professionally challenging because it requires an advanced practice registered nurse, APN, to synthesize complex information about a patient's cardiac history, current symptoms, and potential medication interactions to perform a comprehensive risk assessment. The APN must not only understand the pathophysiology of common cardiac disorders, but also apply this knowledge within the specific regulatory framework governing APN practice in the United States, which emphasizes evidence-based practice, patient safety, and adherence to scope of practice guidelines. The correct approach involves a systematic and thorough evaluation of all available data, including the patient's subjective complaints, objective findings, and medication list, to identify potential risks and develop an individualized care plan. This aligns with the APN ethical and legal responsibility to provide safe, competent, and patient-centered care. Specifically, it reflects the principles of due diligence and professional judgment mandated by state nurse practice acts and professional nursing standards, which require APN to assess, diagnose, and manage patient conditions effectively, including identifying and mitigating risks associated with their care. Incorrect approaches fail to meet these professional standards, focusing solely on the most recent symptom, without considering the patient's full cardiac history or current medications, overlooks crucial contributing factors and potential exacerbations, violating the principle of holistic patient assessment. Similarly, disregarding the patient's reported symptoms and relying only on objective data can lead to misdiagnoses and delayed treatment, which is a failure to adhere to the standard of care. Prescribing a new medication without a comprehensive risk assessment, particularly in a patient with a complex cardiac history, introduces significant potential for adverse drug events and contraindications, representing a direct violation of safe prescribing practices and potentially exceeding the APN scope of practice if not adequately justified by the assessment. The professional decision-making process for similar situations should involve a structured approach. 1. Gather comprehensive patient data, history, physical exam, diagnostic results, medications. 2. Analyze the data to identify actual and potential health problems and risks. 3. Formulate differential diagnoses. 4. Develop an evidence-based treatment plan that addresses the identified problems and risks, considering patient preferences and the regulatory scope of practice. 5. Implement the plan and continuously monitor the patient's response, adjusting as necessary. This systematic process ensures that all relevant factors are considered, promoting patient safety and optimal outcomes. Question 19. Stakeholder feedback indicates that some APN are experiencing challenges in adapting treatment protocols for patients with chronic obstructive pulmonary disease, COPD, exacerbations when new research emerges that challenges established guidelines. Specifically, there is a debate regarding the optimal timing and duration of corticosteroid therapy. Considering the pathophysiological mechanisms of COPD exacerbations, including airway inflammation, bronchoconstriction, and mucus hypersecretion. Which of the following approaches best reflects current best practice for managing such a scenario? Option A. Continue to adhere strictly to the existing institutional protocol for corticosteroid use in COPD exacerbations, as these protocols are established based on historical consensus and are designed for consistent application. Option B. Prioritize patient comfort and symptom relief by administering corticosteroids only when symptoms are severe and persistent, regardless of emerging evidence suggesting earlier or longer treatment might be beneficial. Option C. Rely on the anecdotal experiences of senior clinicians within the institution to guide corticosteroid management, as their long-standing practice reflects practical wisdom in managing COPD exacerbations. Option D. Systematically review the latest peer-reviewed literature and clinical trial data on corticosteroid use in COPD exacerbations. Critically appraise the evidence for its relevance and applicability to the patient population, and integrate findings into individualized patient management plans, potentially leading to adjustments in current institutional protocols. The correct answer is D. Systematically review the latest peer-reviewed literature and clinical trial data on corticosteroid use in COPD exacerbations, critically appraise the evidence for its relevance and applicability to the patient population, and integrate findings into individualized patient management plans, potentially leading to adjustments in current institutional protocols. Explanation. This scenario is professionally challenging because it requires the APN to synthesize complex pathophysiological information with evolving clinical evidence and patient-specific factors to determine the most appropriate management strategy. The APN must navigate potential conflicts between established protocols and newer research, while always prioritizing patient safety and evidence-based practice. Careful judgment is required to avoid oversimplification of complex disease processes and to ensure that treatment decisions are grounded in a thorough understanding of the underlying pathophysiology. The correct approach represents best professional practice because it involves a systematic evaluation of the latest evidence, considering its applicability to the individual patient's unique presentation and comorbidities. This aligns with the APN ethical and professional responsibility to provide high-quality, evidence-based care. Regulatory frameworks for advanced practice registered nurses emphasize the importance of continuous learning, critical appraisal of research, and the application of this knowledge to patient care. By actively seeking and integrating current research findings into the management plan, the APN demonstrates adherence to professional standards and a commitment to optimal patient outcomes. An incorrect approach that relies solely on outdated institutional protocols without considering newer evidence fails to meet the standard of care. This represents a regulatory and ethical failure to provide current, evidence-based practice, potentially leading to suboptimal patient outcomes. Another incorrect approach that dismisses emerging research without critical appraisal is also problematic. This demonstrates a lack of intellectual curiosity and a failure to engage with the scientific process, which is essential for advancing clinical practice and patient care. Ethically, this can be seen as a failure to advocate for the patient by not exploring potentially more effective treatment options. The professional decision-making process for similar situations should involve a structured approach. First, thoroughly understand the patient's current condition and underlying pathophysiology. Second, critically appraise available evidence, including recent research and clinical guidelines. Third, evaluate the applicability of this evidence to the specific patient, considering their individual circumstances, preferences, and potential risks and benefits. And finally, collaborate with the patient and interdisciplinary team to formulate and implement the most appropriate, evidence-based care plan. Question 20. Market research demonstrates that patients often present with complex symptom clusters that can be misleading. An advanced practice registered nurse APN is evaluating a patient experiencing intermittent abdominal pain, nausea, and fatigue. The patient strongly believes they have a rare gastrointestinal disorder they read about online. The APN has conducted an initial physical assessment and reviewed the patient's basic laboratory work, which is largely unremarkable. What is the most appropriate next step for the APN in the clinical assessment and diagnostic process? Option A. Reassure the patient that their symptoms are likely benign and related to stress, given the unremarkable initial laboratory results, and suggest lifestyle modifications. Option B. focus solely on the patient's self-diagnosis, gathering additional subjective information to confirm their belief and proceeding with treatment protocols for that specific condition. Option C. Formulate a comprehensive differential diagnosis based on the patient's reported symptoms, objective findings, and relevant epidemiological data, and then prioritize further diagnostic investigations to rule out or confirm the most likely and serious conditions. Option D. Immediately order advanced imaging studies and specialized gastrointestinal consultations to investigate the rare disorder the patient suspects, to address their expressed concerns directly. The correct answer is C. Formulate a comprehensive differential diagnosis based on the patient's reported symptoms, objective findings, and relevant epidemiological data, and then prioritize further diagnostic investigations to rule out or confirm the most likely and serious conditions. Explanation: scenario analysis. This scenario presents a common clinical challenge where an advanced practice registered nurse, APN, must navigate conflicting patient information and potential biases to arrive at an accurate diagnosis. The APN is faced with a patient exhibiting symptoms that could indicate multiple conditions, some of which are serious and require prompt intervention, while others are less critical. The patient's self-reported history, while valuable, may be influenced by anxiety, misinterpretation, or a desire to please. The APN reliance on objective findings and established diagnostic criteria is paramount to avoid diagnostic errors, which can lead to delayed or inappropriate treatment, patient harm, and potential legal or professional repercussions. The challenge lies in synthesizing subjective and objective data, considering differential diagnoses, and prioritizing further investigation based on clinical judgment and evidence-based practice. Correct approach analysis. The correct approach involves a systematic and comprehensive clinical assessment that prioritizes objective findings and evidence-based diagnostic reasoning. This includes a thorough physical examination, review of relevant diagnostic tests, e.g., laboratory results, imaging, and consideration of the patient's medical history and current medications. The APN must then formulate a differential diagnosis, ranking potential conditions based on their likelihood and severity. This systematic process ensures that all possibilities are considered, and the most probable and critical diagnoses are investigated first. This aligns with the APN scope of practice, which mandates accurate diagnosis and treatment planning based on established standards of care and regulatory requirements for patient safety and quality outcomes. Adherence to these principles is ethically and legally mandated. Incorrect approaches analysis. One incorrect approach would be to solely rely on the patient's subjective report without corroborating objective data. This fails to meet the standard of care for clinical assessment and diagnosis, as it ignores the potential for misinterpretation or incomplete information from the patient. Ethically, it could lead to a failure to diagnose a serious condition, violating the duty to provide competent care. Legally, it could be considered negligence. Another incorrect approach would be to prematurely settle on a diagnosis based on initial impressions or a single prominent symptom, without conducting a thorough differential diagnosis. This bypasses critical steps in diagnostic reasoning and increases the risk of misdiagnosis. Regulatory frameworks for APN emphasize a thorough and systematic diagnostic process to ensure patient safety and prevent harm. A third incorrect approach might involve ordering a broad array of expensive and potentially unnecessary diagnostic tests without a clear clinical rationale, driven by anxiety or a desire to cover all bases without a structured diagnostic plan. While thoroughness is important, an unfocused approach can lead to patient distress, increased healthcare costs, and potential for incidental findings that create further diagnostic dilemmas, all of which deviate from efficient and evidence-based practice expected of APN. Professional reasoning. Professionals should employ a structured diagnostic reasoning process. This begins with gathering comprehensive subjective and objective data. Next, a list of potential diagnoses, differential diagnosis, is generated, considering the likelihood and severity of each. This list is then systematically narrowed down through further assessment, diagnostic testing, and application of clinical guidelines. The APN must remain open to revising their diagnostic hypothesis as new information becomes available. This iterative process, grounded in evidence-based practice and ethical principles, ensures the most accurate and timely diagnosis for optimal patient care.